Well, let's talk a little bit about pain because a lot of my patients, when they come in, they're always asking, okay, am I gonna be able to eat? How does it feel? So tell me your exact, I guess, first 2 weeks with the trays. How did it change your life?
For the first little bit, we did that bit on the radio station where, because you have a bit of a lisp for about 2 weeks, only 2 weeks.
I remember that.
And so we had we did a really fun game where like I was doing sentences with my new lisp for a bit, but it goes away very quickly. Once you learn how to do that. I can't even say it's painful. Because it's not. And honestly, I forget that I have it in, I would say like 80% of the time, because you're just living with it, right?
I think I remember that video clip. I actually was on my way driving to Lorette Dental. I heard you, and I probably shouldn't be texting and driving, but then I recorded it because it was funny because you guys were talking about how you had this lip and you were saying phrases, so it was really funny. But now I don't hear anything at all. Everything's good.
Like again, I have it in, I talk on the radio for a living and nobody ever says I have a lisp. So, and I keep it in during the show, right? So, but no, and when it comes to pain, like if you think there's pain with this, I don't feel pain.
Good.
It starts a little tight when you put the new trays in, but then when you really start wearing them, it's gone within a day or so.
So I can guarantee you, when you're done this treatment, you're gonna miss that tightness around the teeth, right? Because that's when you know things are working.
I already feel that. So sometimes when I like take the Invisalign out to, you do it for a few things. It's the glorious part about it is that you can literally take it out, and it doesn't even feel like it's in your mouth. Whenever that happens, I literally miss it, and I'm always like, where is it? And I'm like, okay, I gotta put it back in like as soon as I'm done eating or whatever the case is.
Good. So you're kind of saying that it's really easy, right? So it hasn't really altered any of your daily routines.
No.
If anything, I find a lot of my patients, when they're going through Invisalign, they actually brush and floss more.
Yes.
What's your experience?
I floss. I never used to floss. I'm gonna be honest. I know. I'm telling this in a dental area. I never used to floss. Now that I have Invisalign, when I put it in, I can feel when I don't floss. So I have those little flossers. I probably floss 2 to 3 times a day.
Awesome.
And I even brush my teeth like 4 times a day.
Wow, good.
It's crazy. Like your hygiene goes up because now you're like, I'm gonna take care of my teeth.
It's an investment now, right? Rather than a chore.
No, and honestly, it's so great when you have Invisalign in. It really just puts everything together, so your gaps don't look as big. So even when I'm taking photos with my Invisalign in, I prefer photos with them in than when they're not in, because everything just looks tighter.